Hey everybody, Coach JJ here at 9:39 on a Sunday evening, which means I have 20 minutes to tell you all the things I've been thinking. So I'm going to try to make this as quick as possible. All right, so Sunday evening lecture, first topic. This is from someone that I spoke to that said they're trying to figure out their understanding of what is dangerous about having diabetes. Is it high blood sugar, insulin resistance, or something else that puts the rest of our body and organs in jeopardy? If it's the sugar concentration, then lowering it is beneficial. If it is insulin resistance, what, if any, is the way to change that? Big, huge topic. This is kind of like a my hair's all silly and stupid. Anyway, this is very much which came first, the chicken or the egg. We don't know exactly for sure, but we can do testing to try to figure this out. Part of that testing directly relies on you. You have to be checking your blood sugar. And this goes into the other topic. The two kind of go hand in hand. I saw a post earlier today. Well, I feel kind of dizzy and I don't know what's going on. And I'm not at the point where I'm checking my blood sugar. And here's some screenshots of what I ate. And it was loaded full of processed foods. White bread and jelly and peanut butter and all kinds. Like, there were very few, if any, whole natural foods, like in their next to natural state. Like, there was no sliced apples, there was no carrot sticks, there weren't any vegetables. It might have been like some microwave vegetable or something like that, but they were saying they didn't feel well. And so when we talk about, well, what is it with diabetes that puts us in jeopardy? And, I don't feel good. What do you think's wrong with me? But I'm not checking my number. The missing piece to that is checking your number. Anytime you don't feel well, check your number. Because it could be high, it could be low, it could be normal. You don't know unless you check it. We can't manage what we don't measure. I feel like well, gosh darn it, you'd think as a Jehovah's Witness about diabetes. I'm allowed to make that joke because I actually grew up in the Jehovah's Witness thing. So I know all about it. But what I'm saying is, we can't manage what we don't measure. If you're not checking your blood sugar, you don't know if you're high, you don't know if you're low. You don't know if the medication your provider has put you on is working or not. You don't know if the dietary interventions that you're doing are working or not. I have somebody that I've recently started working with, and we got to looking at, well, first off, I want you to chart this. And they started charting it. We got to talking. I thought, I see it. That's a little weird. What do you think about that? And we got to talking. And so, you got to put on that detective hat. You have to be paying attention to what you have actually going on. And this person said, oh, well, yeah, there's a thing in that meal that probably didn't do right with me. And oh, there was that thing over there. And oh, I was stressed out on that day, so that's why, yeah, blood sugar was high and so on and so forth. And then they sort of, because they could see that pattern, started adapting their lifestyle habits, mindset, movement, meals. Three things. Three things: mindset, movement, and meals. I'm not going to think this is the end of my life and everything's terrible. I'm going to find out how to create solutions. I'm going to make sure that I'm getting physical activity in whatever fashion, whether it's golfing or hiking or walking or biking or doing chair yoga in the middle of your living room, or standing more than you sit, doing some extra cleaning. All those little things count as physical movement. But then it's also about what you're putting in here. And if you're eating a bunch of processed stuff, chances are you're going to not do well with it. These processed foods, there's a multitude of different reasons why we shouldn't even be eating them in the first place. But especially the stuff that you're buying at the grocery store, you don't know how long it sat in a cooler before they put it out on the shelf. And then you don't know how long it sat on the shelf before you came upon it to pick it up. Foods do have a shelf life. Some stuff, the shelf life is printed on there and it's arbitrary or whatever. But for the stuff we eat for lunch, no. 24 hours. Seriously. Otherwise, histamines develop. And histamines can cause all kinds of symptoms, including elevated blood sugar. Also, skin itchiness, rashes, hives, feeling of anxiety, tachycardia, random changes in heart rate or blood pressure, nausea, vomiting, diarrhea, neurological symptoms like neuropathy. If you have sensitivity to histamines like that, you will experience any number of these symptoms. I have experienced these my own self. And so I hear a lot of people saying things like, well, this just sucks. I'm newly diagnosed. I can't eat anything. I like all the carbs. I don't like vegetables. Tell me what to do. Learn to like vegetables. You're gonna have to. I don't know what it is that bugs me about that, but it's just like people get this idea. Well, I'm just not gonna. I don't know. It kind of sounds like a toddler attitude, quite frankly, and I'm not trying to be, rude or judgmental by saying that, but it literally reminds me of raising toddlers, and I had two of them, and I've dealt with many more of them, and you can't make me put my coat on. Okay, well, go out in the rain and get wet then. And the same thing happens with diabetes. You can't make me eat salad or vegetables. Okay, well, see what happens when you have a high blood sugar and no fiber. Sorry. So circling back around, ooh, and I'm running out of time too. Circling back around to, is it the insulin resistance or is it the sugar that's the problem? I think it's probably an issue for both, but some people fall on one spectrum or the other. Like type 1 diabetics, they just don't produce insulin, and it doesn't matter what they eat, anything at all. The blood sugar is going to go up because the insulin is not being produced to unlock the cell to allow the glucose in. So they have to have insulin, period. So long as they can keep a steady level of insulin and a steady blood sugar level, so we're not going up and down and up and down and up and down, okay, totally manageable. There are a few other things that go along with having type 1 diabetes, where it's not actually just the insulin that's a problem. There's other cells in the pancreas that are damaged and don't produce their appropriate chemicals. That's an entirely different thing outside the scope of the chat that I'm trying to have here. In type 2 diabetes, you can maybe not be producing as much insulin as you should be. You could also be insulin resistant. You could also be putting in a ton of glucosey things that cause trouble. It's really hard to say. I do unfortunately think that a lot of people have been diagnosed as type 2 and they're not. They're type 1.5 or type 3C or whatever, and they don't present like this standard type 1 person, so therefore they don't get looked at as thoroughly as they should. It does not matter what kind of diabetes you have. If you are not paying attention to the 3 pillars of your health, you're not going to do well. If you think negatively, if you're not getting up and moving the body to the best of your ability each and every day, and you're putting a bunch of junk in here, the outcome will be exactly the same. And you might be sitting there thinking, well, I've spent lots of years eating healthy and doing things, and now I have diabetes. And maybe it's because you had steroids, or you had cancer treatment, or something, some kind of other thing where now you have diabetes because of that other thing. Trying to think of nosocomial. Well, that's in a hospital setting, but iatrogenic, maybe the right word. I have to look. I'm so tired. My brain can't function. But nonetheless, some other external source gave you the diabetes. And now we know for sure that COVID does this to people. We have documented research showing people just turning up with diabetes while they're in the hospital with COVID, or people developing diabetes not long after, like within 3 months of having had COVID. We know that COVID infects fat cells and prevents them from secreting a very important chemical called adiponectin that helps regulate blood sugar, and it creates a high level of inflammation, which stimulates the liver to produce sugar to feed the immune system, and so on and so forth. So regardless, you're not gonna medicate your way through it. Medications are necessary. Sure, they can help. But they're only a band-aid on you having to put on that detective hat and adapt your behaviors and lifestyle to what your body's telling you. You might be able to get over it. It might go away for you. Maybe not. We don't know. Either way, whatever little things you do now to intervene are going to buy you extra time. So let's say, you had diabetes for a while, didn't do well with it, on the path to having kidney disease. where you're going to need dialysis and then eventually transplant, or you'd end up dying from sepsis before you ever got the chance of a transplant, right? If you're, 45, 50, and you start doing right by yourself now, instead of having to have the kidney stuff go wrong when you're 60, maybe you could be 75 before stuff starts going south. The point is, every little bit you do today is going to buy you extra time. You're like, the interventions you do now are literally buying your future for you. Just like you invest in the stock market. Just like, you pay into Social Security. You pay in for the future with what you do today. Every little bit counts. And that's my message for today. Yeah, I could talk on this for hours and hours and hours. Even when my voice gets hoarse and raw. But it's time for me to put my children to bed. Oh, one other thing. I like to save the best for last. I got fired. I got fired from my job. I was working as a pharmacy technician for a grocery store chain pharmacy. And I thought, this will be fun. Something we haven't done before. So why not, just do it. And, while you're working on your side business and all that stuff, just do this. And I found the following. I was instructed to lie to a physician about about dispensing a medication for one of their patients that brought a prescription in for a controversial medication, which we will not discuss. You can ask me about it privately. But I was told to call a doctor's office and lie. Specifically told to lie. Like, that was the words they used. They had HIPAA violations with disclosing patient names on products that they put back on the shelf to be redispensed to someone else. They didn't take off the name labels. That's a HIPAA violation. They didn't wear gloves when they were dispensing pills, and coughing all over what they're putting in, and didn't clean the machine or whatever when they were counting the pills, so that all the pills were there and powder got on there, and then other pills got on there, and so on. So that built up. They didn't wear their mask correctly on their face, more like a chin diaper kind of thing hanging down here. They made fun of patients. They talk crap about each other when the other wasn't there at the office. And they really didn't like it when I told people, hey, I think I might have a coupon to put in for you, so your medicine isn't $1,127.76. Your medicine will now be $103.14. I told people, it's kind of like you go to the store and they're like, oh, you put your card in. Oh, you saved $27 today. Yay. I thought I was doing the same thing, but they didn't like that very much. So I was fired for not being a good fit. Yeah. God damn right I'm not a good fit. Not for that crap. In fact, I'm actually going to call the state pharmacy board tomorrow and report everything that I saw, not because I want anybody specifically to get in trouble, but because these kinds of things affect millions of people across the country and across the world. And that needs to stop. We need to be doing things correctly. Anyway, oh, shoot. It's 9:59. I reckon I gotta go. Time to make my chitlins, go to bed. But, thanks for your time and listening today, and I'll see you soon. Coach JJ.